A tool created at UW-Madison is gaining national attention for the way it helps communities tackle health disparities.
Chloe Morrissey spoke with the creator of the tool about how it can shape the way researchers are allocated to disadvantaged communities and how Wisconsin communities have adopted the tool.
Where you live can shape your health just as much as the care you receive. That's why Dr. Amy Kind and her team at UW-Madison developed a tool to map health disparities in communities.
This tool is focused on the environment. It's focused on income, education, employment, housing quality.
It's called the Area Deprivation Index, or ADI. The data is available for each state. You can visit the online neighborhood atlas, select a state, and see areas least and most disadvantaged using a 1 through 10 scale.
There are lots of use case stories from across the country of community members, public health agencies, nonprofits that are trying to improve health in their own communities, using the tool to inform where they should send nurses or volunteers or different resources to try to help the people that they serve.
Like in Milwaukee, helping identify priority areas when replacing lead pipes.
When we looked at the ADI map of Milwaukee, there are quite a few census block groups with the highest score of 10 on the near north side and the near south side. That is also where there's high density of lead service lines.
And Epic Systems, another Wisconsin-based company, expanding the reach of ADI even further, linking over 100 million patient records to an associated ADI.
A complete game changer. In Epic, we have a complete record of a patient. So really, we put the patient at the center and all of the data around the patient. And all of that data often is data that's collected within a clinic or a hospital. But we know that things that matter for a patient's health don't just happen in a clinic or a hospital, but actually happen in their everyday lives, in those in-between moments.
Now physicians have that broader insight into those in-between moments. Dr. Kind's goal when creating this tool.
Any doctor, any health system, any group that's interested in health data across the country can access these ADI metrics along with the Epic data in order to inform health delivery, which is very, very exciting.
Here at UW, Dr. Kind and her team are now looking at how to track where someone has lived their entire life, telling me the next step for ADI is expanding it from a community snapshot to a lifetime roadmap for health. The hope is to connect lifelong exposures to long-term risks for things like heart disease and cancer. Reporting in Madison, I'm Chloe Morrissey.